How do multifocal IOLs work in refractive lens exchange? Imagine waking up and seeing clearly at all distances without glasses or contacts. That's what multifocal intraocular lenses aim to help you achieve. In refractive lens exchange, your natural eye lens is removed and replaced with an artificial lens designed to correct your vision. Multifocal intraocular lenses are specially crafted to give you sharp vision at near, intermediate, and for distances all in one lens. These lenses work by having multiple zones with different optical powers built into a single piece. Think of it like a multi-layered lens that directs light differently depending on where you focus. When light enters your eye, the lens splits it into different focal points, allowing your brain to interpret images at various distances. This means you can read a book, see your computer screen, and drive without constantly switching glasses. There are two main types of multifocal intraocular lenses. The first is refractive multifocal lenses, which have concentric rings with different refractive powers. These rings work by bending light in specific ways to focus on near and far objects. Their performance can depend on your pupil size and how well the lens is centered. They often provide good distance and intermediate vision, but might sometimes make near vision less sharp. Some people notice halos or glare around lights, especially at night, and may experience slight reductions in contrast sensitivity. The second type is diffractive multifocal lenses. These use tiny concentric rings with microstructures that create interference patterns, splitting light into multiple focal points. They tend to be less affected by pupil size and often give better near vision than refractive lenses. However, because of the way they split light, some contrast sensitivity might be slightly reduced, and intermediate vision can sometimes be less crisp. Some multifocal lenses combine both refractive and diffractive features to maximize vision at all distances. The choice of lens depends on your specific visual needs, eye health, and lifestyle. For example, if you do a lot of close-up work or reading, a diffractive or combined lens might be ideal. In refractive lens exchange, these multifocal lenses can significantly reduce your dependence on glasses, especially if you have presbyopia or high refractive errors like myopia or hyperopia. But it's important to remember that some side effects like glare, halos, or reduced contrast sensitivity can occur, especially initially. Usually, your brain adapts over time, and these effects often diminish. Getting the best results depends on precise measurements of your before surgery and choosing the right lens for your eyes. Not everyone is a candidate for multifocal lenses. People with certain conditions like advanced glaucoma or macular degeneration may not benefit as much because these conditions can affect visual quality and contrast sensitivity. In summary, multifocal intraocular lenses in refractive lens exchange work by splitting or refracting light into multiple focal points, giving you clear vision at different distances. They are a powerful tool for reducing dependence on glasses but requiring careful evaluation and planning with your care professional to ensure they fit your individual needs and health. Always consult with a qualified ophthalmologist to discuss your options and understand the potential benefits and risks of this advanced vision correction approach.